Good morning, all, and welcome to the Bidders Conference. We are here with our friends at Mass General Hospital and the Center for Community Health Improvement. My name is Mo Barboza, and I serve as Director of Community Engagement at Health Resources in Action. I'll be facilitating our conversation today. I'm joined by some of our MGH partners. I'll just give them a chance to introduce themselves. They will be available for questions that we'll do at the end. Leslie, do you want to introduce yourself?
Sure. My name is Leslie Aldrich. Welcome, everyone. I'm the Executive Director at the Mass General Center for Community Health Improvement.
All right. Danielle?
Hi, I'm Danielle Marable. I'm with the MGH Center for Community Health Improvement.
All right. And Kim?
Hi, I'm Kim Lopez. I'm a project manager at the MGH Center for Community Health Improvement. Welcome.
All right. Thank you all. Just for kind of information's sake, we're going to walk through this opportunity, talk a little bit about the LOI itself and the process, and then we'll have an opportunity for questions at the end. We do have some objectives for today. Hopefully by the end of today, you'll learn about this opportunity and specifically in workforce development and behavioral health needs in Suffolk County. That is the limit of this opportunity. You get an overview of the DON process and the Community Health Initiative process, understand how these priorities were chosen, learn about the eligibility and the elements of the LOI and the process for submitting it, and also have a sense of the timeline. We're in our welcome. We'll do a little overview of the funding opportunity. We'll talk a little bit about the initiative, the upstream approaches, the actual letter of inquiry. In there, we'll get into eligibility and how you submit it, as well as a timeline, and we want to leave plenty of time for questions. If you have questions while we are in process, please use the chat box to put the questions in, and we'll be looking at them as we go through, as well as being able to look at any of them at the very end, and we'll try to answer as many of those here as possible that makes sense to answer here. But I do also want to make sure that folks are aware of the TA session that is happening next week, and that may be another place for those more specific questions to be answered. We'll do our best to handle the process questions here today. So just at a glance, this total grant funding is $2.251362. That is not as easy as saying $2.25 or $2.2, but I want to be specific because there is a reason for why those numbers are as they are. These are for community-based nonprofits, coalitions, and local governments. As I said, we'll talk a little bit about eligibility later on, but we want to emphasize that there's a broad set of possible partners and folks who might be applying. We're looking to address root causes of poor health outcomes and disparities, and we'll talk a little bit about how DON dollars work, as well as the purposes of this particular strategy, this particular funding strategy. The strategies that will be funded are workforce development programming and increasing access to behavioral health services through community health workers. We'll walk through exactly what that is, and importantly, just to cover that the focus here is on social determinants of health and root causes, that we are looking specifically at upstream approaches and trying to create policy and systems change. Geography is important here. We are looking at Suffolk County, so it's Boston, Chelsea, Revere, and/or Winthrop. I'm going to say that again: Boston, Chelsea, Revere, and/or Winthrop. That is the limit of this particular opportunity. It's a two-step process, so we're looking to do a fairly short letter of inquiry, followed by an invitation for requests for proposals. And so we're thinking that there will be a large set of folks who will join the letter of inquiry, and then we'll narrow it to a smaller set of folks to be invited for the request for proposals. That LOI is due Thursday, July 2nd at 3 p.m. Thursday, July 2nd at 3 p.m. Thursday, July 2nd at 3 p.m. We have an online portal for you to do the actual submittal, so there'll be a place for you to upload the 2-pager, and then obviously folks have a copy of the RFP that they can, the call for LOI that they can review for the questions. I'm going to move us forward. Some details on the actual funding opportunity. So the 2 categories are workforce development and behavioral health, community health workers. And important there that we note the these are 2 separate opportunities. So an organization, a coalition, a piece of government can apply in both of these by submitting separate LOIs. And really important that you're going to have to be specific about which one you're applying for as we go forward. I just want to be clear that when we're talking about Suffolk County, it is Boston, all of the neighborhoods within Boston. It's Chelsea, Winthrop, and Revere, that those communities are included. And so you could be working in any one of those or some mix thereof. Okay. How many years? So this is up to 3 years of funding. And so each grant can be renewed up to those 3 years. And so if you're thinking about applying for 3 years or 2 years or 1.5 or 2.5, you can tell us how long you're looking to apply for. And the number of awards that we're looking to make are 2 to 3 awards within each of the funding opportunities, and that's up to about $125,000 a year if it's spread out over 3 years. So if you think about it as 3 awards of about $375,000 or so. Specifically, the workforce development aims to support programs with a focus on resume building, job readiness, skill training, education, English as a second language or ESOL, and through cultivation of relationships with employers, trades, and unions. And again, because we're looking to go upstream, we're trying to create policy and systems change that creates an opportunity for folks to access these things, take advantage of them, put them into work in the context of their work. So we're trying to create change that moves forward these workforce development programs. On the behavioral health, community health worker side, it's increasing the pool of community health workers and recovery coaches with specialized skills in mental health substance use training, who represent and serve low-income immigrant, LGBTQ, seniors, or other communities of color through coordinated funded recruitment and training programs. So again, really thinking about how are you creating either policy or systems change to increase the number and increase the effectiveness and opportunities for these community health workers and the work that they do in these spaces and with and from these communities. These are not direct program or service grants, but they may have an element of that within them. And so we'll talk a little bit more about that as we go forward. Please feel free to use the chat as a space to post any questions as we go forward. We'll try to address some of them as we're going, but also address them at the end. And I'm going to move us forward to talking about the determination of needs. And at this point, I'm going to pass it over to Leslie Aldrich.
Great. Good afternoon, everyone. Thanks to all for being on this call. We're happy to see so much interest in these grants. We know how much funds are needed to address really the poor outcomes we are seeing in our neighborhoods and communities, especially now as a result of disparities and racism that we're seeing in our communities. So thank you all for your interest. So regarding determination of need and what determination of need is, As a nonprofit hospital, we're regulated by both the Internal Revenue Service, the Attorney General, and also DPH to meet the needs of our communities. So when we as health organizations have projects that improve our facilities, we renovate, we do construction, we expand, we also have to show how our expansion, how our community health work is expanding in the community. And we have to do that through an application that we put through to Department of Public Health whenever we do these projects. The projects, and we'll go to the next slide, but basically our work has to make sure that we are identifying community identified needs that are informed by our community health and needs assessments and through our implementation plans. And the needs must address our social determinants of health, health equity. They must go upstream to improve communities. So our expansion, so this DON was an expansion of our electrophysiology services and renovation of our space. And as Mo said, we have over $3 million to invest. So the total cost of our project was over, I want to say, $100 million. But 5% of that then has to go back into the community based on these regulations. And so what we're working with today, as Mo has said, is over $3 million, over two going to these two strategies that you'll hear a little bit more about. And then we're also going to be releasing another additional $1.1 million to preserve affordable housing. And that's going to be through a separate process. I know that was stated in the LOI. And all of these monies will be have to be spent by the end of September.
Mm-hmm. Thank you, Leslie. I just wanted to address a quick question from Mary. She asked if ESOL is a required component of the workforce development grant. It's one of the options. It's not a required component.
Right.
We're going to keep going. Again, please put your questions in the chat, and then we'll see if there are ones that we can address as we're going, and also we'll address some questions at the end that we can pull from. So we want to talk a little bit about where some of these the funding areas were chosen and kind of why the focus is here. There were community health needs assessments and implementation plans that were done for Boston as a whole and for North Suffolk. So if you see on the left-hand side, there's the Boston Chinat Chip Collaborative that worked for the first time, and I'm really, really proud of how Boston came together to do one community health needs assessment and CHIP for all of the different organizations that would need to file one there. And then the North Suffolk Public Health Collaborative, Revere, Chelsea, Winthrop also did a joint process. And from there, as you can see, there's lots of surveys and focus groups, many participants, lots of different languages, many different key informant interviews. We looked at a whole lot of data, the kind of national data from the census that's specific to these neighborhoods, public health data from the Public Health Department and the Boston Public Health Commission, behavior risk factors, as well as the data that came from those that primary collection, and also really deeply involving lots of residents and lots of community meetings, lots of working groups, and obviously some of the folks who are on the Bidders Conference with us today were a part of that. It was a really important piece of pulling out this information, was to be able to look at the needs in neighborhoods and also think a little bit about the opportunities to address them. And so from there, there were 4 top priorities. And if you notice, there's some overlap between these and where we've ended up. The top 4 priorities for Boston and Norfolk, there were 3 that overlapped: safe, affordable, stable housing, economic, financial stability, and mobility, including living wages and educational pathways, and then behavior health, including substance use disorders with an emphasis on youth and families. For Boston, only the 4th one was access to health, social, and childcare services. On the right-hand side, you'll notice the social determinants of need, and this is a really important box for us to kind of understand where this work comes from and why we are so focused on the kind of getting at root causes and the social determinants, is that what affects the health of people is not as much clinical care as we give credit to. So that's about 10%. And genes and biology is maybe another 10%. The physical environment plays a huge role. The health behaviors of folks play a huge role, but also social and economic factors play a big role. And so if you pull this out, the non-biological or clinical is 80% of what helps put people in a healthy space or making them healthy. And those are all influenced by these social determinants of health. And these are things that we can do something about in this space. And importantly, that we can address in this funding opportunity. We're going to talk a little bit more about that as we go forward. So who is involved in this choosing of these strategies? The hospital has convened a community advisory board. This community advisory board was part of selecting the strategies and the priorities, and they also have informed the allocation committee. Really important that this is a diverse set of folks from lots of different parts of this combined geography. So people from Boston, from Chelsea, from Revere, and representation from Winthrop. And part of their charge is really to give input to what the hospital is doing in general, specifically to review and give input to the community benefit filing, which is filed with the Massachusetts Attorney General. That's dollars that the hospital is putting forward and giving to community efforts. And then importantly here is to guide the identification of priorities and the process for DON, determination of need, filings with the Department of Public Health, which then makes available the dollars that we're looking at today. This is going to be a laugh for anybody who's been on the CAB. It says that it meets quarterly with one annual public meeting. I will divulge that they have met much more than quarterly to be able to make this funding opportunity available. And so just if any of the folks are on the call today, I just want to extend that thank you for your hard work in making this funding available, and the hard work of identifying those priorities and helping us to craft this opportunity. So the Community Advisory Board, some principles and criteria for funding. On the left-hand side are some of the principles for how they've guided this work. You'll notice on there things like striving to achieve health equity, being evidence informed, having some clear goals and objectives, aligning with other evidence-based collaborative initiatives, thinking about and pooling the funding with other opportunities, intentionally engaging with community-based organizations, smaller ones, maybe some of the unusual suspects, some of the folks who maybe aren't always the first to jump into opportunities like this, and trying to create opportunities for them to join the conversation and to be a part of any funding opportunities, and absolutely assessing the community impact. Focus on policy systems and environmental change, which we'll talk a little bit about more here, and making sure that things can be scaled. But I do want to just list that first one, which is the greatest impact on the upstream root causes of health challenges, including social determinants of health. This is, a 3-year grant, and part of what the hope here is that you're creating lasting change by focusing your efforts within those 3 years on changing policy and systems. On the funding criteria side, this is really part of how these were developed, was to understand the need by reviewing the demographics, the disparities, poverty and hardship indexes for subsets of neighborhoods, and this is within North Suffolk and within Boston, and getting a really clear idea of where the needs are and what those needs are and where the disparities are, who's affected by those disparities. So understanding those and adding kind of where the work needs to be, where there may not be any other funding, where there's an opportunity for collaboration, blending with that the population size, so how many folks can be impacted, will be impacted, obviously the opportunity, and with a real nod that and understanding that the Mass General Hospital has a history with supporting, working with, and working in a set of communities, and that's an important thing to continue and to build upon. Again, I'll just ask folks if you can put your questions in the chat. We will get to them as we go forward. Some of them we'll answer along the way, and some of them we'll look at the end of the session when we do questions. So, just which strategies and funding methods did the CAB select? So these are the 3 strategies that were selected. As Leslie talked about, there is a strategy around affordable housing, which is about leveraging existing and new shared funding pools to support acquisition, production, and preservation of deed-restricted affordable housing. And that's a separate opportunity that our allocation committee is taking up. The 2 that we are looking at today, workforce development programming and community health workers, we've spent a little bit of time defining those already, but those are where this funding opportunity is focused. And then the methods chosen, we had a healthy debate about how to do this process. And one of the wonderful things about having community members be part of the CAB was that it allowed us to have folks who are on the other end of these opportunities giving us some real input about what it takes to really reply to this. And so the method that was chosen was this 2-step process. We're asking people to complete a letter of inquiry, which is a 2-page submission. And so we're trying to make this as low effort as possible to allow everyone to participate. We have a set of questions we're asking you to complete, and hopefully those are very clear. We'll have a chance to go over the LOI, but that this allows us to get the ideas and the framing from as many folks as possible, and the allocation committee will choose from those letter of inquiry a set of folks in each of the 2 areas to be invited to the request for proposals, where they'll be asked to do a longer, more formal proposal. Part of the idea here was that we really wanted to focus on the ideas, not the ability to complete an LOI. And so, and in making it simple and making it something that folks can do without putting hours and hours of effort into it, we wanted to allow for those smaller organizations, the folks who don't have a grant writer, the people who aren't going to be able to contract a grant writer to do an LOI, to have the opportunity to submit their LOI, and that we can get the best thinking and best ideas involved, regardless of the size of the organization, its budget, or how sophisticated their fundraising or development program is. As mentioned, the affordable housing is a separate strategy that we'll be addressing through the allocation committee. All right, please continue to put your questions in the chat. I know that Danielle just put a link there in answer to one of those questions that folks had there. We'll continue to have those resources, and we'll make available those links as well. All right, well, we wanted to talk a little bit about health equity and going upstream. On the right-hand side is one of my favorite charts, which is really about what is health equity, the difference between equality and equity. We'll dive into it a little bit more as we go forward. But on the left-hand side, this really helps us think about what does it mean to really go upstream. You'll notice that downstream are medical interventions and providing clinical care. This is, after the disease or after the injury is already in place, what are we doing to address the hurt? And at that space, it's typically, especially from a hospital point of view, more the kind of clinical interventions and medical interventions. What are we doing to kind of cure things? At the midstream is really addressing the individual needs and addressing some of the social needs there. There may be areas in which we're working with specific segments of the population, specific segments of the interventionists. There may be places where we are looking at some of the dynamics that put people into harm's way. And then at the upstream level, we're really looking at community impact. What are the laws, policies, regulations that create community conditions that would support the health for all people? How do we improve community conditions? This is where we're looking to change policies and systems. I like to say to folks that systems change is really about how systems work with one another, and can we make them work together at a way that benefits the health of communities in general. Policies can be at the large level, like a government policy. It can also be an organizational policy. It could be an institutional policy. It can be a sector policy. All of these might make some real changes. Examples that I'll use, and just to think about different kinds of policies, could be something within your school district, could be something about how benefits are dispersed. It could be something about how your local government deals with specific things that would help people be healthier. So those could be some of the big P policies, and then some smaller policies might be within a certain organization that you're looking to change. So a housing authority policy, a health related policy that you might want to make some changes in. We'll talk a little bit more about that as we go. Please continue to use the chat for questions. So just defining health equity, we're going to do some level setting just to make sure that at every turn we have an opportunity to ensure that folks are on the same page here. So health equity is achieving the highest level of health for all people. This is a definition that I think we can all kind of get our heads around. The second definition is from the Healthy People 2020. It really is more of an action-focused definition, which is about, says that health equity focuses societal efforts to address avoidable inequalities by equalizing the conditions for health for all groups, especially those who have experienced socioeconomic disadvantage or historical injustices. So this is proactively creating health by addressing those avoidable inequalities and equalizing conditions. And important that as you're thinking about the work that you're going to be doing, it's how are we creating equity needs to be at the center of your thinking. One of charts that works really well to talk about the difference between equality and equity. Equality is giving everybody the same thing. So at the top of the chart there, you see where everyone has been given the same thing. It doesn't work for some. It's really hard to work for a few folks. There's some people that it works perfectly for, and there's some people for whom it would put them in danger to do that thing. Equity means giving people the thing that they need that works best for them, that actually helps all of them get to the same outcome. And so this is what we're trying to create, is the equitable space where people, all people can get to the same high level of health. Some definitions for downstream, midstream, and upstream approaches. As we talked about, downstream are interventions that address immediate health and social needs of populations. Midstream look to reduce exposure to health risks by improving physical working living conditions or through promotion of healthy environments. And upstream's approaches really look to reform fundamental social economic structures that distribute wealth, power, opportunity, and decision making. For this funding opportunity, it's important that we are aiming towards upstream approaches, but you may have some midstream actions that are part of this and some service pieces that are part of what you're doing. And so as you're crafting your LOIs, you're thinking about what you might want to do, think about how you're trying to create that policy and systems change, but where is it that you're also actively, you might be doing it through some active change making in that midstream area, maybe prototyping a particular systems change or creating the program that makes that particular change that you're trying to make at the policy or systems level. All right. So health equity focuses upstream, and I want to just mention that we borrow this from our friends in San Francisco to say that a lot of what's been done in this work has been in the past really focused way downstream. And so mortality has been the place where a lot of folks have been really focused. So things like infant mortality, life expectancy, homicide, and those are really important. And so we want to make sure that we are not saying that you should not be doing this work. This funding just doesn't apply at that end of the spectrum. But a lot of work, especially in the health and public health sector, in the safety sector, in community change sector, has looked really downstream, almost as looking at things after they've happened. Or it's been around disease and injury. So things like communicable diseases that we're experiencing right now, chronic diseases, you can think about things like diabetes and heart disease, and then injury, whether that's from violence or unintended consequences. Important that these things are still addressed, but they also tend to be after things have already happened. There's been, over the course of the last 20 years, a real focus on risky behaviors. We've done a lot of change making over the course of the last couple generations in how people view things like smoking, alcohol and drugs, sexual behavior, etc., and promoting good behaviors like physical activity and nutrition to counter some of the ways in which some risky behaviors have put people in danger. We still see the effects of many of these risky behaviors kind of persist, and that's one of the reasons why the focus has moved more upstream, is that even though we've done some really good intervention work in this area, a lot of those risky behaviors and disease and injury persist and continue to lead to the mortality that we see, especially disproportionately in some communities. And so it's important that we address living conditions, so things like the physical environment, social environment, economic and work environment. Important that we are looking at institutional power, government agencies, corporations, businesses, schools, this focus on laws and regulations, and also at the role that nonprofits play, and really important that we are looking at some of these social inequities along the way, that part of what persists in terms of the first three columns that we looked at were some real disparities based on class, race, ethnicity, and other statuses that put people at risk by those very systems and conditions that we're looking at. And so upstream thinking is about really the ways in which we are looking at creating equity for folks across these social inequities and addressing institutional power while making real changes in the living conditions and the conditions that people are experiencing. And that these changes are not just to address what's happened before, but to make sure that the future is healthier than the past has been. And so we wanted to give you some examples of policy systems and environment and just be a little bit more specific about working upstream. So policy is an improvement to law, regulations, procedure, administrative actions, incentives. You can think about this practices and procedures within institutions or government. Systems are changes in systems change or changes in organizational procedure and norms. Could be about who's working on what, could be about resource allocation or programming within those systems, how systems work with one another, how people are able to navigate those systems. All of that is systems change. And environmental changes could be physical, observable changes in the built economic or social environment. I like to just say that in the environmental change space, there's a lot of opportunity to think about how that social environment impacts our health. So how do people interact with one another, and how does that impact the health of those communities as well as their economic environment? What are they able to do economically, and how does that impact their health? And certainly the built environment, what creates health for them in terms of what they interact with physically. We want to show you some examples of these and have these be a little bit more related to what you're facing. So some policy systems and environmental changes that you could think that are just examples for workforce development. So a policy change is really simple, like increasing the minimum wage to a living wage. That is a huge change in policy that we know has on effects in terms of the health of populations who see an increase as a way to stabilize their living conditions and stabilize some of the things that can improve their health. Systems changes here might be working with employees and employers to change eligibility requirements for hire, or ways in which those employers are able to cast a wider net, improve their recruitment to bring in people who in the past have not been represented or have not been a part of those systems. Environment might be removing wage theft, absolutely, improving conditions, retention and career advancement. Certainly ways in which how people experience the environment that they're in can have a real impact on workforce. So if you feel safer, more valued, and are actually safer at work, those can be some big changes in workforce development. On the behavioral health side, reducing barriers for mental health coverage, some real important policies there, both at the organizational and at the government level that could be worked on, reducing barriers to matriculation or completion degrees for mental health workers of color or any group. Those kinds of addressing what are the system barriers for folks to really become part of those communities, folks from the affected communities to become part of the healing apparatus or be part of the community health workers who are working on those issues. And then in the environment space, addressing community conditions that contribute to mental health. Obviously, we talked about racism and poverty, but there are quite a few others in there that you might want to address. These are examples, and this is not an exhaustive list. These are not suggestions. We're not saying that you should be thinking about doing something within these. These are just examples, and we could have put any other set of examples here. So I want to make sure that no one feels like we are qualifying in any way, shape, or form the examples that were put here. Please continue to use the chat box for your questions, and we will make sure to address them as we go forward. Any of the ones that aren't addressed in the haven't been addressed already, we'll make sure that we do, and also we'll have time for questions at the end. All right, so the letter of inquiry, what is that? I know some folks will, they've seen LOI and they're not always sure what the I is. Sometimes it's letter of interest. But letter of inquiry for us, it's really an opportunity to get a sense of what is it that you're looking to propose. This, as we've mentioned, it's a 2-page proposal on one of these 2 areas, the workforce development programming or the access to behavioral health services to community health workers. There are some eligibility concerns that we want to make sure we are absolutely crystal clear about. So eligible entities to pursue this funding are 501c3, so your typical nonprofits, 501as, which are basically charities, community-based nonprofit organizations, coalitions, local government. So local government would be from any of those communities that we've talked about: Boston, Chelsea, Revere, and Winthrop. Coalitions are existing groups that have been working together to address a space. Obviously, folks who are working in community-based organizations, you might be working with some partners, so you might have some collaboration that you want to put together, or a partnership. You may think about how you're partnering with a local government. We want to hear all of those, want to hear from all of those different kinds of organizations and entities who are eligible. We're looking for you to propose work that is focused in Suffolk County. You must submit this 2-page LOI, one for each strategy. You can obviously just submit an LOI for one strategy or the other, or you can submit one in each. It needs to be signed by the person who is the signatory for your organization, the executive director, CEO, or some equivalent within your organization. We are looking to fund, 2 to 3 years of funding. Can also do a 1 year, but each year you'd have to complete an annual and final programmatic expenditure report detailing the use of the funds and what the impact has been, and that will have some impact on your ability to continue being funded within those 3 years. So that annual one is really important, as well as the one at the end. What can you use the dollars for? And this is a really important question. Very often folks are wondering what is it that they're going to be able to spend the dollars on, and they may have some ideas. Staff salaries, consultant fees, operating costs, indirect costs cannot exceed 15%. What's not permitted, and this is a really important piece for these DONs dollars, because they are not allowed to be spent on any clinical or medical care. And that's by definition of what DON dollars are for. No building endowments. We can't fund any deficits, and we cannot be influencing elections. And so you can't spend these dollars to get your buddy on to become the next state rep for your part of the neighborhood. Cannot spend these dollars on constructions or renovations or any kind of capital campaigns, and no grants will be made to individuals. And so hopefully that clears up the use of funds. If you have any more questions, any specifics on use of funds, if you have a specific question that doesn't fit this, please make sure that you address that to us. Either you put it in the chat box today or you submit it. Online we'll be taking questions. You can send those to Kim Lopez, and she will get those answered to you by next week. And then I want to be really specific that people understand that no parts of the Mass General Hospital are eligible for this funding opportunity. No entities that are in any way, shape, or form connected or part of partners are able to apply for this, nor the Brigham. And important that if you have a question about whether or not you'd be eligible, I would say send us that question immediately so that we can help you to be clear about your eligibility. Someone just asked if the Boston Public Health Commission, which is a part of local government, would be eligible to apply, and the answer is yes, BPHC can apply. Thank you, Leslie, for being clear with that answer there. If you have one of those questions, please put them in the chat. We will try to get to them as quickly as possible. Wanted to just walk through the LOI itself. So the elements of the LOI and how it's going to be scored. As we mentioned, this is a 2-pager, and so while there are many questions here, we want you to pay attention to the weight. So as you're going ahead and answering questions, please give some credence to the weight of the score as you're taking up space on the page. First is the statement of organization's mission or vision. Please be brief and concise here. We're just looking for you to describe what it is that your organization does. If you're applying as a collaborative, you can talk about the purpose of your collaborative or your coalition. If you're an entity of local government, if you have a mission or vision statement, we'll take that. Secondly is to describe the target population, the geographic area, current need, and the plan on using these funds to meet. Really, if you can be as specific as possible about who it is that you're trying to impact with directly the dollars that you're seeking or the impact of the change that you're making. Really important that we're clear about what that population is. And if there is a specific geographic area, you might be looking at a set of neighborhoods or a specific part of a community. And so being specific about that, or you might be looking at all of Chelsea or all of North Suffolk, really telling us where is it that you are looking to focus. A clear articulation of the need, why it's important to do this work there, and then how these funds will make the change that will meet that need. We asked how residents will benefit from the proposal and how many residents you hope to serve. And so really important that you're telling us how this will impact the folks who actually live in these geographic communities that you're naming. What upstream policy systems change will your initiative affect? Being clear about where is it that you're looking to create kind of lasting change in terms of policy and systems. What outcomes do you hope to achieve with this funding? So what is it that will actually be changed by the funding that you do, and specifically, what those activities will affect. How will you engage residents, including those underrepresented in decision-making processes? So where is it that residents will be a part of the process? And you can think about that from the idea making to the implementation, through any decision-making, any of those spaces in which residents might be a part of the process. Are there complementary organizations in your community who work with your target populations? We want to get a sense if you know who the other folks are that are doing this work. And please describe how you will collaborate or ensure your efforts are not duplicating and are coordinated and aligned with any of those other organizations. So we will just want to make sure that you know who else is doing this work, and if there are other folks, how you either are aligning or coordinating with them to affect the kind of change that you're looking to make. There are several non-scored elements, and these are things that we are still requiring for you to include, but will not be scored. So we want to know which strategy you're focused on, the amount of funding you're requesting. Again, we have a top limit, but you may be requesting some number that best fits the change that you're trying to make in the programmatic elements that you have. The number of years of funding requested, it's up to 3 years. And then explain if your initiative is evidence-based, evidence-informed, or why there may not be evidence for it yet. And we want to be really clear that there is no weight to which of these three your initiative may be using, whether it's evidence-based, evidence-informed, or if there isn't any evidence yet, an explanation of why there isn't evidence. We just want to have a sense of your understanding of what you're trying to do and where the relationship to evidence may be. So one of the things that's I think going to come up as we go forward is where is it that you're going to, when you're going to submit this proposal, where is it that you get to ask questions and get understanding before you're submitting it? And we realize that there is a pretty fast turnaround on this. So there are 3 opportunities to ask questions. Obviously today we'll try to get through as many of these questions as we can within our time frame here. We will also have made available for you a frequently asked questions opportunity, so you can email any questions that you have about the proposal to Kim, and we will receive those questions by the end of the day on Tuesday the 23rd. If folks could get us those questions by the end of the day, Tuesday the 23rd, we are hoping to be able to turn those around to you quickly. On the 24th is a TA session. It's an hour from 4 to 5, where we'll be diving just a little bit deeper than we did here today into some of the components of the funding opportunity, and also an opportunity to address some questions if folks have questions in that time frame. And then on the 25th, we're hoping to release any of the answers to the frequently asked questions, and that'll be a compendium of any questions that we've had, including those submitted by email, those that were part of the TA session, and any significant questions from today. And so those are just opportunities to have questions answered and hear back from folks what has been answered, and we want to make those answers available to everyone. So that's part of the transparency of this process. And so one of the reasons why we're asking people to write down the questions in the chat boxes so that we answer them and everyone gets to see what the question actually was instead of people verbalizing those. And the same thing for the email ones and the ones that we'll do in the TA session. All right, so just a quick overview. Again, I think I said this a couple times already. The LOIs are due Thursday, July 2nd by 3 p.m. It is a two-pages that we would ask you to PDF and upload. And how you do this is by submitting it at the Health Resources in Action portal. When you do that, when you sign in, you're going to create a username and password, so your email, and you'll create a password, and then this will be your account. When you log in here, you're able to work on submitting your LOI. There are some questions that are part of the portal that are not part of the two-pager, and these are the kind of who's the contact, some really simple questions that we want to make sure that we have basic information about. So I encourage you to log into the portal, see what those questions are, and then be clear about answering them, having those answered and completed, and then upload your two-pager that can just focus on those questions that we just went over in the LOI. And this is both a way for us to have similar information for everyone across the board and give you as much space to tell us about your project on those two pages without, you know, what's your 501c3 letter and some of those other bits of information that just take up space. So we are at the step where we're going to look at the timeline, and then we'll take some questions. I know some questions have already been added to the chat box. If you have any other questions or questions you've been thinking about, please go ahead and start adding them now. I'm just going to go over the timeline first, and then we're going to get to questions, and we'll invite our panelists to address some of those. So the general timeline for this project is, we talked about that online technical assistance session, which is June 24th from 4 to 5. The LOIs are due July 2nd at 3 p.m. By July 21st, organizations will be notified if they're going to be selected for the RFP, and we'll release that RFP to them. The RFP will be due September 1st by 3 p.m. and then notifications of awards will go out on September 28th, 2020. That is the general timeline. I want to be clear that only LOIs that are highly scored will be invited to submit the RFP. Part of this process is to be able to identify what the good ideas are. So we can't tell you how many LOIs will be selected. We're not sure, even though we know what the number of awards will be, we're not sure how many highly scored LOIs there would be. So I would encourage you to do a good job with your LOI, but know that we're not trying to, you know, cut it down to a specific number. We are really actually open to the good ideas and good thinking that people submit, and that will lead us in terms of how many LOIs are selected to move forward into the RFP process. With that, I'm going to move us into the questions and answers part, and I know that Kim has been busily answering some questions as we've gone forward. I'm going to just start us in the chat from the top and see if there's any questions that have not been answered that we should address. We did address the ESOL question. One question was, do applicants need to apply for the full amount? We said no. You can apply for up to the amount that actually makes sense for the work that you're doing. There was a question about information available for the affordable housing that has a separate process. Leslie, do you want to just talk a little bit about that?
Yeah, I put that in the chat that we're going to be reviewing projects on that are going on in Suffolk County this summer with our allocation committee, and we will be determining which projects to fund, probably 1 to 2 projects, and money will be going out this fall.
Thank you, Leslie. Is a single link available now to this deck and the community assessments as well as other information on the project? If you could post it to this chat. I don't believe there's a single link yet, but we should be able to. I'm sorry, go ahead, Kim.
I did share it. I shared
wonderful.
those links a little earlier. And just to be clear, we will have a copy of the slide deck available to all attendees after the conclusion of this bidders conference. We will email that.
Great. And Danielle, also, you posted a link on here for the community health needs assessments. If anyone wants to review those are in the chat as well. I would encourage you to take a look at those, both that they give a sense of where this came from, but also are very reflective on what the needs are. There's a question here. If you receive LOIs reflecting similar or complementary approaches, will you suggest combined efforts / coalitions? I want to say if Leslie, do you want to talk a little bit about that, or do you want?
Yeah, I think if there's work, I think if there's room to collaborate and it makes sense, definitely we will try to put those together and suggest that you put an RF, you put the application in collectively.
And again, we do encourage you to take a look around in your community and see how what you're doing may align with what other folks are doing. It is short time frame. You may not notice everyone, so we will play that role as well, but we do want you to take a look around before you submit. What are your expectations regarding COVID? And I know there was another question about that. We have separate plans for what can be done remotely and what can be achieved in person. Absolutely. So I just want to talk a little bit about the kind of COVID restrictions that we're under now. Part of this funding is really starting in October and moving forward 3 years from that. And I think folks should be really planful about what may be still in place as restrictions in the coming year, and then also that we hope that will change in the near future. Leslie, do you want to talk a little bit about just COVID in general as it relates to this opportunity?
Yeah, I mean, we're really trying to go to upstream approaches, so policies and systems changes. So realizing that there's probably a need right now to be addressing, having approaches that are related to COVID. So if it's remote work and so forth. And I think that's fine, but you do have to have kind of these upstream policies and systems changes, as Mo said.
And I'll just add that the dealing with the COVID crisis is an example of really deeply necessary downstream approaches for systems, and that as folks are really familiar, the Mass General Hospital and partners in general has been deeply engaged in that downstream, both in the clinical side and the community side, and that many of the folks who are on this webinar today are also part of our heroes doing the work to support communities and at the local level. And so while this funding opportunity is really focused upstream, we do want to recognize that people are doing a lot of work in that downstream area. There was a question about whether there's any prioritizing within workforce development, and the example given was, are we seeking programs that are more focused on resume building and job readiness over education or ESOL? And I'm going to go with the no there. Not at all. There's no weighing. We want you to make the case for why you're focusing on where you are. And I would say to you, spend your time really focusing on why what you're doing is important. I wouldn't spend a lot of time trying to make the case for why one of these elements is more important than the other. Tell us what you're focusing on and why that's important to do. All right. Kim has put in a set of links in there. I'd ask you to, if you haven't had a chance, to maybe just to get the actual call for LOIs, use those links to get there. And we'll keep going. There's a set of questions here. One was for workforce development programming, can we seek funding to address policy systems, environmental needs, and not the actual delivery of training? Absolutely. Leslie, do you want to say anything on that one? I just see your head going up and down.
Absolutely. Yes.
Absolutely.
Yes.
And thank you, Mary, for that question. We're absolutely looking to address that policy systems and environmental needs, and there are opportunities to do within this funding strategy something that blends the delivery of training and changes that you're trying to make and trying out those changes, but we definitely need the focus to still be on that policy systems environmental change, so it can definitely be even more upstream. That's definitely a possibility. Yeah. All right. So Terry Kennedy asked about the reality of COVID's impact in kind of all operations of our organizations and some of the restructuring that's being offered to mitigate the impact of COVID. Should we focus our proposals based on what we project our operations will be over the next couple of years while COVID is still in play, or what we want to accomplish once COVID is under control? Really an important question, Terry. I think we're all struggling to understand what the landscape is going to be post-COVID, and imagining that there will be a post-COVID, and what will our organizations look like. I think you need to think about what your current planning is for how you're going to be working in the future, and I'd encourage you to be clear about how your organization's planning on work over the next couple years, and if there are some relationships to COVID, to include that in how you describe the work. Leslie, do you want to say anything to that?
I would just say if the work you're doing as a result of COVID you think is going to be sustained over a long period of time past COVID, it's going to be a new way of doing business, then definitely. If it's really for something that you think is going to be disappearing in the next year or two, I would try to think of something that's really more longitudinal. Yeah.
There was a question about whether or not there was any restrictions for faith-based organizations. The eligibility requirements are exactly the same, that you have a 501c3 or a 509A, or part of a coalition or a local government. So as long as the organizational restrictions are there, that makes sense. Any other restrictions on faith-based or spiritual-based organizations? I see none from our panel. Nope. Okay. Hopefully that answers that question. We were asked about state-funded institutions located in Boston. Are they eligible? Leslie, what would you say to that? A state-funded institution located in Boston?
Yeah, okay, so that's a good question. I think as long as they're serving the residents of Boston and the rest of Suffolk County, I think that's fine.
I would say to you, really think about how you're positioning the work that you would be doing under this funding within the geography, and specifically impacting the geography. Leslie, Did you want to add to that?
No, that's exactly. It has to be meeting the needs of this Suffolk County.
We answered yes, the BPHC can apply. Who would be the signatory for a coalition? Many coalitions have either a coordinator or a chair. Often they are the signatory for it, or a fiscal conduit or fiscal management entity. because the award would have to actually be made to a qualifying organization for that coalition, I would think you'd want to have that person be the, someone from that organization be the signatory. Do you want to add anything to that? Nope. All right. The question is, can we apply in collaboration with another nonprofit? The answer there is yes. Any partnerships? You'd want someone to kind of be the lead on paper in terms of where the dollars would flow to, but certainly apply if there are partnerships and collaborations, those make sense. There was a question about a community college. Leslie, do you want to address that?
Yes, I think community colleges, as long, again, if they're serving the residents of Boston, you know, Chelsea, Revere, Winthrop, I think that's fine.
And a community college, by definition, is a entity of local government. If you're, again, addressing the needs and the work will be done in the geography about that geography, that makes complete sense. And community colleges within the service area, yes, that makes sense. There's a question, we would intend to collaborate with partners and MGH organizations, but as long as the funding comes to our organization for our staff doing the work, would they still be eligible? Leslie, do you want to address that?
Yes, so I know Mass General's involved in all of these communities, so we're happy to collaborate on any work to help support it. We just can't be supported financially for any of the work.
All right, so some of you who are working directly with Mass General or another partners entity or the Brigham, the dollars cannot go to support the staffing and the work of those hospital entities, but you certainly can be working with them, absolutely. How did that happen? All right, back to normal. There was a question about, are individual stipends allowed as an expense? Could there be stipends to individuals as part of this expense? Danielle, I see that you're going up and down. I'm going to ask you to maybe answer that question out loud for the folks who can't see you.
Yes, stipends are fine. That's completely appropriate.
Mm-hmm. And if you think about how you are going to be doing your change making, who's going to be involved, how residents will play a role, how workers who are part of the training program or part of even helping to describe or make decisions about the processes that you're going to be involved in, stipends might be a really important piece of that. There was a question about a fiscal agent and who can apply there. The Massachusetts Association of Community Health Workers uses HRA as its fiscal sponsor. They do all the backroom work for us, but we are independent. Yes, MATRA will be able to apply for funding, even though HRA is the fiscal sponsor. And just for transparency's sake, for everyone who is on the call, I am employed by HRIA, and that's why the question was asked, that there's a role that HRIA is playing in facilitating some of this process. So folks, our entities and programs that are part of HRA will not be able to be eligible, but those that we play a fiscal sponsor for, fiscal conduit for, would be eligible. And you can think about that the same for organizations that you're working with in other spaces. All right. Lori asks, I read that you are looking for evidence-based policies for the LOI. I don't see it here. Do you want to address that, Leslie?
Policies for the, yeah, Danielle.
Oh, she saw it later. It's not it's not ranked or what's the word I'm looking for?
Weighted.
Weighted.
Yes.
It's unweighted. We just want to know if it is evidence-based or not and why. That's all we need to know.
Yeah. So again, we're not giving priority or giving more weight to evidence-based strategies one way or another. We just want you to know and be able to tell us if there is a evidence base or if it's evidence informed, or if there is not evidence based. how you know that and why it doesn't have that evidence and it's not weighted. Thank you. Could you give us feedback? Could you please give a specific example of service delivery under workforce development? So one of the questions that was asked before is, could you work on policy systems change and not do any training? That's a yes. And then the kind of the opposite, could you do work on policy systems, environmental change, and workforce development and have some training be a part of it? That's also a yes. So that would be an example of where there would be some of the service delivery as part of it. What I'd ask you to really think about is how that service delivery is in the service of making the change that you're looking for. Is this an example of what that change would be? Is it work towards that change being in place? Something that really connects it to the upstream change that you're making. All right. You mentioned at the beginning that the focus is in service delivery, but it can be included. We just elaborated a little bit on that, as long as any of the service delivery that you're doing or any of the programmatic elements are in service of that policy systems change. That can definitely be a part of this. We want you to really be clear about the change that you're making, and then the service delivery might be a step in that direction. All right. For the workforce development strategy, the RFP talks about adult workforce development. Will a request focus on building a teen workforce pipeline along with young adults qualify? I'm going to ship that over to our MGH friends.
It's a good one. Kim or Danielle, do you have a?
I think for the workforce development here, we are specifying adults, so
Yep.
18 and over.
Mm-hmm. 18 and over, yeah. Part of the rationale there is that the allocation committee is following through on what the community advisory board put forward. The community advisory board looked at the priorities set within the CHNAs that were listed and made choices from there, and the choice was to focus on this adult workforce development.
Right, that's correct.
All right. Okay, boom, boom, boom. I'm looking to see if there's anything we haven't answered yet. A lot of thanks for your answers. Kim, you're getting a lot of love here. A lot of folks thanking you for those. So Peter Tam also said, I'd like to follow up on workforce development in relation to young people. We're looking at adults 18 and up. Will food and rental assistance for clients to prevent homelessness be eligible in the workforce development space?
Although I think it would be great to fund something like that, I would say no. This is really for thinking about policies and systems and thinking about workforce development training, but not these immediate needs, unfortunately.
Thank you. Jane Baker said, what about the Suffolk County District Attorney's office? So just for the folks who are joining us and can't see the thumbs up and the grinning and supportive yeses, we're saying what, Danielle?
Yes, Suffolk
Yes.
County DA is eligible.
Yep, they are an element of government. All right. Julia asked that in the LOI under geographic area served, there are options to choose Revere, Chelsea, Winthrop, but not Boston specifically. I read that Boston agencies are eligible. Is that right? I will take a look at that, but Boston is definitely one of the choices that you can choose. So if there is a correction to be made there, we will make that correction. Just to be clear, the geographic area for this opportunity is Boston, Chelsea, Winthrop, or Revere, or Revere. So all of those four communities are eligible in any parts therein. Mary asks, is there work done in Suffolk County, but non-Suffolk County residents will also benefit? Is that okay? Clarify the upstream work to change industry culture and government policies would benefit non-Suffolk County residents. Leslie, you're muted.
Yeah, I would say as long as you could show that this is going to benefit Suffolk County residents in addition.
Yep.
then you'll be okay.
All right. Lisette Blondet listed yay as her reaction to eligibility, I believe. Can you please share the link for the HRA portal? I think, have we shared that link already? Is that, it's also in the RFP itself?
It's, I did not share the link. I shared the link for the request for letter of inquiry document. At the bottom of that document is a link to the HRIA portal.
Yep. So within that document is the link to the portal. And we'd ask folks to go there. We've got a couple moments left here. I just want to turn to the panel and see if there's anything that any of you would like to add to the conversation thus far. No, Leslie, Danielle, Kim, nothing to add. I'll ask if any of our 58 attendees has a question that they would like to put forward. Okay. Courtney, I saw that you had put your hand up. I asked if you were able to put it into the chat. I'm going to just open you up to ask you if you have a continuing question. If you'd like to ask the question, go ahead. Courtney, if you're there, you can unmute yourself and ask the question.
This is Courtney. I had no question. I think I hit something I wasn't supposed to. I'm
All
sorry.
right, no worries. Thank you
Sorry
for
about
joining
that.
us. No worries. All right, have a good day. It happens, it happens. I'm gonna lower your hand so we're not confused. Are there any other questions? And if folks wanna put them into the chat, we can take them. And give folks a moment, okay. No questions from me, but this was super helpful. Thank you for your time and for the chance to see Danielle for the third and fourth time this week. Yes, absolutely.
All right, I'm just saying nobody's showing me any love, so I'm really taking some offense to this. So.
There you go. Kim says, thank you. I just want to remind folks of the opportunities to post, to ask questions. So if you have questions that come up over the weekend when you're having your nice cold lemonade, or Sunday night when you're finishing reading that book that you started last weekend, please email them to MGH DoN @partners.org. Do that by June 23rd at 5 p.m. so that we're able to post the answers to those questions by June 25th. Also, the technical assistance session will be on the 24th from 4 to 5. Please register for that so we have a sense of who's coming and how many folks we're going to have. We're going to be delving deeper into some of the concepts within this funding opportunity and answer some questions there. All right, with that and seeing no other questions, I'm going to thank our panelists for being willing to take questions and celebrations and thank yous from our group, and thank the folks who joined us today in the Bidders Conference for your participation, attendance, and for your wonderful questions, and for asking things that other people may have wanted to ask and didn't. And so it's really important that your voices are heard. Please use, again, the MGH DoN @partners.org to submit any additional questions, and have a wonderful rest of your day and have a great weekend.